if the view of language access is changing, not maybe to you, but to other stakeholders in the healthcare system, it's changing from like maybe like a civil right or patient experience to patient safety. Is that going to bring new pressures to you at all in your position? Or is that kind of another thing where it's healthcare system dependent and how language access is already being used and thought of in a healthcare system?
Mm-hmm. Um, I would, if language access is being run well, then then this patient safety aspect should already be integrated, should already be at the forefront. Pretty much, even though I'm not under compliance, like I said, or even patient experience, patient safety is really top of mind when I'm creating policy or procedures. For example, the one area that my healthcare system traditionally has not requested any sort of credentialing has to do with language. So if you are a provider and you happen to speak another language, traditionally my healthcare system would allow you to speak that other language with your patient. There's no, you look like you speak Spanish, you sound like you speak Spanish, feel free. And it's only recently that we have implemented a qualified bilingual staff program where even though you may be a heritage speaker, meaning your first language is Spanish, and I keep using Spanish as the example, but your first language is something other than English, that doesn't necessarily mean that you have been using clinical terminology at home or that you're even familiar with clinical terminology in that first language, in that other language. So taking an assessment, we are now requiring our bilingual team members to take an assessment to validate their language ability. And if you choose not to take that language assessment, then that's totally fine. It's voluntary and you can just speak English here at work. But otherwise, the language assessment will determine if someone's conversationally fluent or clinically fluent. And that is all related to patient safety. So I think some of the changes that are happening, I honestly don't think it's going to change what we do very much, because I think most language access managers already are thinking of patient safety. It just might reinforce some of the things that we're required to do or that we've been doing. We might refine how we're doing them.